Wisdom teeth. Keep them or remove them. Some say they should be removed, while others claim, I've lived with mine my whole life and I'm doing just fine. Ultimately, it's unclear to anyone what should actually be done with these wisdom teeth. Is it dangerous for the adjacent tooth? Is it normal if it's erupted but not completely? Why does it hurt even if there's no cavity? And in the end, should you remove it or leave it? If you have these questions, give this a like.
Now, the wisdom tooth issue, is it really a serious matter to consider, or is it mostly just rumors?
It's 100% a question that needs to be considered. But the thing is, people often ask, how dangerous is it and what should be done about it? If a wisdom tooth has erupted normally, then there's no need to do anything with it. The main problem with wisdom teeth is their improper eruption. That is, they can be dystopic, meaning they grow completely wrong, sideways, or don't fully emerge. And most importantly, caring for a wisdom tooth is always very problematic because it's located so far back and access to it is very poor during cleaning. I mean, we can't open our mouths wide enough to reach it and clean it properly. Why does a wisdom tooth cause these problems? Plaque just slowly builds up on it because we don't clean it well, especially if we don't visit a dentist, so we just neglect this tooth when it comes to brushing. Plaque accumulates on it and it simply starts to get inflamed. And such a tooth starts to hurt, and treating it, well, just as it's hard to clean, it's equally difficult to treat such a tooth. There are, by the way, special dental drills with an angle to reach back there, but it's extremely difficult. It's hard for the doctor and it's hard for the patient. And so such a tooth often just has to be removed because it's so difficult to treat. So that's where the trickiness lies. Otherwise, a wisdom tooth is a perfectly normal thing. Millions of people live with them, hundreds of millions, I'd say. And if it has erupted normally, as I said, then there's absolutely no need to do anything to it. Of course, very often when patients are undergoing orthodontic treatment, like straightening their bite or teeth, orthodontists recommend removing wisdom teeth to make room for the movement of the teeth that are, let's say, crooked. Well, that might be the only reason for it, really.
But anyway, I've heard that a wisdom tooth is a vestigial organ. Is that right? True or not?
I wouldn't say it's a vestigial organ. It's a perfectly normal occurrence. I mean, it's programmed by nature, so it's not really a vestige. It's a different story that it doesn't participate in the chewing process. That could be the case. Such teeth, even if they haven't all erupted, really don't take part in chewing. So it might seem like it's useless, but in nature, nothing is truly useless. If, as I said, it has come in correctly, let it stay. If it doesn't bother you and you aren't planning any orthodontic work to fix your bite, or rather to straighten out your teeth, let's say, if they're crooked, then don't touch it. The main dangers of what can happen with a wisdom tooth is an impacted wisdom tooth, which means it hasn't fully erupted. These hoods form there and food gets trapped underneath them. It's very difficult to clean. This food sits there, let's say, it rots and leads to inflammation, and it starts to bother the patient. So the first thing is, of course, impacted or unerupted teeth, which lead to inflammation of the gums around the tooth or the tooth itself. The second danger is precisely the consequence of the first cause. When we don't clean this tooth well, right, and plaque builds up on it just like on all teeth, a wisdom tooth is no different from other teeth in this regard. This is, of course, the development of cavities or a caries process when the tooth begins to be destroyed by decay. And this is exactly the main problem, especially in dental treatment, because access to such teeth is very problematic and difficult, and the doctor often has to use special access skills to somehow treat it properly, but it's incredible. So most often such a tooth, well, that's exactly why it's removed, especially if it's, okay, for one thing, if it's just a cavity, right, and we were able to reach this cavity, clean it out and put in a filling, that's one story. But if the nerve has already become inflamed, God forbid, and we need to treat it endodontically, that is, treat the tooth nerve, remove this nerve, clean the canal, then it's practically, well, very, very difficult and sometimes even impossible. Therefore, such a tooth must be removed. Although, in fact, it could have been treated, but access is impossible, so it's removed. The next dangers of wisdom teeth. This is most often caused by incorrectly erupted or teeth that are lying incorrectly. We also call them dystopic teeth. That is, when a tooth erupts incorrectly, it starts to push right into the neighboring tooth, can you imagine? There, for example, our molar pushes into the seventh tooth, and besides its eruption, imagine what pain that is, it slowly pushes our perfectly healthy tooth. This is not only painful, it can also lead to consequences. That is, we could lose the neighboring tooth as well. So one of the dangers is, of course, when a tooth erupts into a neighboring healthy tooth standing next to it. So here, such a tooth must also be removed, and very carefully, so as not to damage the neighboring tooth. This is also very, let's say, difficult for doctors, surgeons, and dentists. By the way, wisdom tooth extraction is always called a complex tooth extraction by default. That's it. By default, there's simple tooth extraction and there's complex. Now, wisdom tooth extraction is always a complicated procedure. This is because, first of all, access is difficult, and secondly, the tooth is pressing against something, and something is in the way. And also, by the way, there can be such a complex tangle of roots in these eighth teeth that it makes them impossible to remove. That is also a problem. Well, and another reason that follows from the previous one is precisely the shifting of the dentition, because our wisdom tooth presses on the adjacent teeth and all the other teeth start to adjust to this, and such a shift begins, an adaptation like that occurs. So the shifting of other teeth that aren't even related to this tooth can also be a cause. So tooth displacement, of course. The next danger, it also basically follows from everything mentioned above. It's this chronic site of infection. It's either a gum flap that constantly needs to be trimmed or cleaned out, or it's tooth decay that hasn't been treated for a long time. It's just sitting there and access to it is impossible. And so we wait until it starts hurting really badly. So one of the next reasons is a chronic site of infection in the oral cavity. Well, and the next reason that very often accompanies wisdom teeth, which is why they are so painful, is what's called irradiation, where our pain also strikes. That is, a wisdom tooth doesn't just hurt in its location where it's situated, right? But it also irradiates, meaning the pain spreads in different directions. And this is exactly such a danger, a characteristic feature of these wisdom teeth. Of course, it irradiates, or this pain from the wisdom tooth itself can radiate to the neck. It can even radiate to the ear. Patients very often talk about this, and to the temple. So this is also such a, let's call it danger in terms of probably sensations or pain, right? I mean, it hurts completely. That is, a wisdom tooth hurts in a completely different way, so it's better to solve this problem right away. Again, that's why patients remember and then pass it on by word of mouth about wisdom teeth. Oh, I suffered so much, oh my, I don't even want to remember it. Although it would seem other teeth also hurt, but a wisdom tooth can hurt in a completely different way and irradiate, hurting unlike other teeth, I emphasize, radiating to the neck, shooting into the ear, and even the temple.
And there's a myth that if a wisdom tooth doesn't hurt, then everything is fine. Is that true or not?
Tough question. Actually, it might sound like the truth. Well, if the tooth doesn't hurt, what can you do with it? I mean, why do anything with it? But at the same time, we are still practicing medicine. Medicine is a science, so it might not hurt for a while. Therefore, the main task is to perform a diagnosis. So we've done a 3D scan, or at least an X-ray, and we understand, here's our wisdom tooth, here it is lying like this or lying, standing like that. It doesn't matter. At least we can prepare. So it's clear that if everything is fine with that tooth, and we see on the X-ray that it won't cause any trouble, then there's really no need to do anything with it, especially if it's not bothering you at all. But if we see that it's misaligned, or that a gum flap is already forming, then it's really just a matter of time before it starts causing problems, that's all. For now though, it might not be an issue. So you can't really give a definitive answer here. That's why it's best, if you have a wisdom tooth, to just go and see a doctor for a consultation. Any professional, from a hygienist to a general dentist, can tell you what's going on with the tooth and what to do, whether to wait or just relax and let it keep growing. So that's how I would answer that question.
Is it true that a wisdom tooth always pushes the adjacent teeth?
That's not always the case, but in most instances, yes, for the most part. But again, it's not always like that. A properly erupted wisdom tooth shouldn't be shifting anything. It's just, this myth comes from when a patient has crooked teeth and needs treatment. Usually, orthodontists, those are the doctors who straighten teeth and put on braces. Well, they often ask to have that tooth removed because they need space, since the teeth are already crowded together. And to move those teeth, they need room to shift. Think about it. They've been crooked for years, and now we're trying to align them. We can get that necessary space by removing those wisdom teeth. That's likely where the myth comes from, that they must be removed because they're in the way. It's not always true. It all depends on the specific goals and the task at hand. If you've heard any other myths about wisdom teeth, let me know in the comments and I'll try to answer them. Which wisdom teeth can you keep if we're putting it that way? The first factor is, of course, access. When your wisdom tooth has fully erupted and you are able to easily reach it in order to clean it thoroughly and properly, making sure that no food particles or plaque are left behind after brushing, in that case, yes, you can certainly keep the tooth. You can also keep a wisdom tooth if it's not inflamed and doesn't have any cavities. So you're perfectly fine keeping a wisdom tooth like that. You might not really use it much. As I mentioned, wisdom teeth often don't play a part in the actual chewing process, but you can keep it without worry if it's healthy and free of decay or inflammation. When is it absolutely necessary to remove a wisdom tooth? First and foremost, when the tooth becomes inflamed, meaning it has been infected by decay. It's not just some tissue around it like a hood, which you could trim or clean, but when the tooth itself is actually affected by cavities, it starts hurting, and the doctor says, I just can't get to it. I won't be able to treat it because access is limited. In this case, the wisdom tooth will have to be removed, otherwise the inflammation will spread. And it's better to do it in a timely manner. If the tooth has already started bothering you at the cavity stage, it's best to remove it. The second reason to remove a wisdom tooth is when a so-called displaced tooth starts erupting incorrectly and begins pushing against the adjacent healthy tooth, becoming a threat to it. In that case, of course, such a tooth must be removed. And thirdly, there are cases based on specific indications, most often orthodontic ones. Wisdom teeth are removed when a patient is planning or has already started bite correction using braces or aligners, meaning when the patient is undergoing treatment with an orthodontist.
Many people are afraid of the pain when they have to get a wisdom tooth removed. Can you tell us at all, will it be painful or not?
Well, I'm actually a person from the Soviet Union myself, from back in the 80s. And of course, all those horror stories about wisdom tooth extraction really have their roots in that old system of state-run medicine back in the distant Soviet era. Not because it was bad, Soviet medicine was actually quite remarkable, but back then they simply didn't have the technical or diagnostic capabilities or the right tools. And back then, it's true, these stories were passed around by word of mouth about how they practically hammered the tooth out, literally trying to gouge or chisel it out somehow. They compare it to hammering out metal car parts at an auto shop, except here it's happening inside a person's mouth. For modern dentists, everything is completely different now. First of all, there's anesthesia. It used to be less effective, but with today's anesthesia, they'll numb you up perfectly and you won't feel a thing. Secondly, if the tooth is visible, it can be easily removed with forceps. Moreover, a doctor will always perform a diagnosis by looking at the X-ray first. If they see that the extraction will be problematic, they won't just grab the forceps and start pulling. They'll calmly administer anesthesia and then section your tooth into pieces, you see? They'll literally cut it into parts with a drill and remove it piece by piece. The process of removing wisdom teeth is known as a complex extraction. Yes, it is complex. Yes, it takes a bit longer, but you still won't feel anything. But this way, the doctor can calmly section the tooth and remove it in pieces without traumatizing you or the neighboring teeth. So there's really no need to be afraid of it. This is probably the key point as well. Why even today, despite modern advancements, patients who've had a wisdom tooth removed recently still say, oh, I can't do that again, it was so hard. Of course, it's very hard to keep, well, your mouth open like that because the doctor also needs to see somehow there must be access. And that's the difficulty because you have to keep it open for a long time, opening your mouth very wide so the doctor can reach. The doctor, of course, gives you a break, asks you to close your mouth, sit for a bit, then open it again. So the duration of a wisdom tooth extraction, again, it's truly a complex extraction. It can take a long time, but it's not painful. There's no need to be afraid of it. Wisdom tooth extraction is now as easy as possible with special materials, various drills that can saw it through and remove it easily. So don't worry, go ahead and book it, but be prepared that the extraction will just take time. Like instead of say 5 minutes for a tooth, it'll take 15 to 20 minutes. Well, just a bit longer, that's all. Only so that, as I said, we can painlessly saw through your tooth and take it out in pieces.
How long to heal afterwards?
Well, for a wisdom tooth, sometimes they even give you sick leave for the extraction. So, well, be prepared, like any tooth extraction anyway. I think you can easily stay on sick leave for up to 7 days. This is only because it might be painful. That's why painkillers are always prescribed for wisdom tooth extractions. You will be taking them 2 to 3 times a week. Any non-steroidal drug, a non-steroidal anti-inflammatory, but it will heal a bit longer. There will even be a feeling for a while that it's painful to chew. The main point is, with any extraction, by the way, this applies directly to wisdom teeth, but also any other extractions too. Under no circumstances are any warming procedures, no baths, pools, saunas, no physical exertion or training recommended. It's not just, it's strictly prohibited because our body, first of all, has experienced such stress. Secondly, everything related to warming can increase our swelling, which will definitely occur after the extraction. This is a normal reaction of the body to the extraction. So there will definitely be swelling, growth factors will go to that area. That is, the body will try to restore this place and the blood flow there will increase. And we go to the bathhouse and warm up even more, increasing blood flow. The swelling will increase, stagnation and inflammation will start there, and it can be very serious inflammation. Therefore, under no circumstances should you heat it. No stresses. I mean, it was already a stress for the body. Don't give it another stress. So we cancel the bathhouse, sauna, pool, physical activities for, well, 5 days for sure. 5 days for sure, then everything will recover quickly. But I'll emphasize again, you need a bit longer to recover after a wisdom tooth than after regular teeth.
I also know that some people have several wisdom teeth removed at once. Is that also normal? Or maybe it's better to remove them one by one. What kind of recommendations can you give here?
First of all, be sure to discuss it with your dentist. The dentist, based on, as I already told you, 3D diagnostics or a regular X-ray, will be able to see how difficult the work will be. But it's best to remove wisdom teeth one at a time, of course. This is more about a practical, everyday point of view. I mean, you remove a tooth, and imagine you won't be able to chew on that side. You remove a tooth, you're fine, but you're letting that side recover. And imagine if we remove both wisdom teeth on one side. It'll be impossible to chew at all for the first 5 to 7 days. You're not going to go around hungry, as they say. So it's very uncomfortable. Of course, you could remove all 4 at once. There's nothing scary about that. But again, it's a complex extraction. So the doctor assesses these consequences themselves. If they see it'll be easy, sometimes a wisdom tooth isn't deep in the bone, sometimes its roots are underdeveloped, and it'll, as they say, pop right out, But sometimes, a fully formed wisdom tooth has such powerful roots that the doctor knows the extraction will take more than 1 minute. And they'll say, no, let's just do one for now. Come back in a month or a few weeks and we'll do the next one. Removing them step by step, one tooth at a time, is what I consider most practical. If you have any questions left about wisdom teeth, message me. Link in the description.